Okay, we're going to start critiquing our 5-view C-spine. We're going to start with the lateral. The first thing we want to make sure of is that all the anatomy is properly demonstrated on the film, that all 7 cervical vertebrae are in fact visible. The spinous processes should be clearly demonstrated in profile, as well as the vertebral prominence of C7. The zygoapophyseal joints should be open. No overlap should exist between the joints. The intervertebral disc space of all 7 vertebrae should be open. There should be no overlap of the mandible and mandibular rami, and the chin should be slightly elevated to prevent that. The film should be centered to C4 to clearly demonstrate everything that we need to see. The next image is the oblique projection. The main thing we're looking at on this image is the intervertebral foramina of the foramen farthest from the image receptor. We want open disc space in all 7 of the vertebrae, and we should make sure that we see it, all 7 of the cervical vertebrae on this film, as well as the top of T1. The chin should be elevated, and there should be no overlap of the occipital bone of the axis. And the next image is the apiaxial projection. We want to see at least 5 cervical vertebrae on this image. The mandibular angle and mastoid process should be equal distance to the vertebrae. The spinous processes should be equal distance to the pedicles and aligned with the mandible of the cervical bodies. We should see open disc spaces on the axial projection here. And the next image we're going to take a peek at is the odontoid, or the open mouth. We want to make sure that the dens, the atlas, and the axis are all on our film. The patient's mouth should be widely open, and the occlusal plane should be superimposed. There should not be a tongue shadow. The tongue should be depressed to the roof of the floor of the mouth. And the mandibular rami should be equal distance from each other to make sure there's no rotations of the patient's head. We want to check for the articulation between the lateral masses. Side-to-side movement or displacement of that could indicate a fracture. And this film looks pretty good.